Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life.
Hello, this is Becca Rose, your host of Myo360, Holistic Solutions for Better Breathing and Better Sleep. Thanks for joining us today. I'd like to talk a little bit more about some specific patient experiences. And in the past, we've spent a fair amount of time talking about younger kids and even adults, but today I'd like to focus more on the 60 and older group of people that I'm working with right now. It's not uncommon for 50, 60, even 70-year-olds to reach out to me. And they were maybe referred by their dentist, or they found me online because they were doing some deeper diving into their symptoms. So today I'd like to showcase 4 cases with 4 unique situations. So let's get right into it. The first client is a 55-year-old male, and he was diagnosed with sleep apnea about 2 years ago. He does not like wearing his CPAP machine, and he has been looking for solutions to try to make his CPAP machine more tolerable and more efficient. Now, this is not completely uncommon for that to happen, where you wear a CPAP machine and you still have events per hour. If you are someone that's wearing a CPAP machine and you have your machine linked up to one of the apps on your phone, it will give you data throughout the night that tells you how many episodes of breathing difficulties you experience. And they're like, I'm wearing this CPAP machine. I'm still having 10 or 12 or more events per hour a night. What is going on? So he was not happy with this. He was not happy with this because in his case, the machine overnight would start to ramp up pressure. The machines are designed now. The one that I used to wear didn't do this. It was an older style machine, but the machines now, as they monitor your stats throughout the night, they have the ability to change the airflow, to change the pressure. So what was really bothering him about his machine is that he would be sleeping, and then all of a sudden he'd start to have an event, an apneic event. The machine would ramp up air and it would basically blast a strong blast of air down his throat. And then this is what was waking him up. So even though he was having some apneic events per night, but the apnea was being controlled by the machine, but the machine now was waking him up because it was big change in that air pressure, which was disturbing his sleep. His dentist actually referred him to me, and we got started right away on myofunctional therapy. And within a couple of visits, he already reported that his reports from his machine were going down by 5 to 6 events per hour. So that was pretty significant. He decided to take the trust of his dentist, who was referring him to me, and trusted his dentist and said, there must be something about this if he's recommending this lady to help me with my sleep. So he was very pleasantly surprised that even after 2 visits, he was seeing his breathing efficiency begin to improve, and his apneic events were being cut down to about half. So throughout this process with him, we also uncovered a posterior or a mid-tongue restriction, which was preventing the back part of his tongue from being able to fully lift and seal. He agreed. We went through the evaluation and I explained what I was seeing or not seeing with his muscle function, and recommended that he have a conversation with an airway-focused dentist. He agreed, and he went to their office and decided, yes, I think that this is the missing piece. We got him ready for his tongue tie release. He had his tongue tie release, and then his sleep improvements happened. They improved even more significantly. That was a really good result. In the midst of his process, He also showed a lot of interest in learning more about the functional breathing that I teach as well. So we took a couple visits and we got deeper into some of the functional breathing patterns because he also travels a lot to high elevations. And the way you breathe can change significantly when you get into elevations that you're not used to. So he had great improvements with his travel and everything with learning how to breathe more functionally. And he was able to breathe better when he went to higher elevations. So he finished his myofunctional therapy program. He was very happy with the results. And he then recommended me to some of his colleagues and friends who had similar issues. So that was a really good outcome for him. Everybody's a really good outcome. It's quite the opposite. People usually say, I wish I knew about this years ago. I wish someone told me about this 20 years ago, 10 years ago, whatever it is. So he had a really good outcome as I would have expected. Let's talk about our next lady. She is 63 years old and she has a very notable tongue tie. And she was a bit upset that nobody has mentioned this to her in her life because she's 63 years old and she has spent her whole life struggling with sleep, struggling with breathing, had some speech concerns that were never able to correct through speech therapy throughout her lifetime. Why didn't anyone tell me? Why didn't my dentist ever tell me this? Why didn't my doctor ever tell me this? And then I explained to them, they just didn't know. They don't know. They're not taught this in school, in dental school, medical school. Pediatricians, doctors, dentists, they're looking for a tongue tie that's right on the very tip of the tongue that most of us don't have. Most of us have that more mid-tongue restriction or that posterior tie, sometimes it's referred to as. So she's upset. Why didn't anyone tell me this? You don't know what you don't know. Okay. So it's nobody's fault. But what's good now is that, and it's not too late to help you. All the things, sleeping, speech, like I mentioned before, she decided not to have a tongue tie release. And we focus mostly on myofunctional therapy and then some functional breathing as well. Within 2 visits, I'm sleeping better. I'm dreaming more. By the end of her program, she was able to say some of her letters more clearly than she's ever been able to in her life because the therapy we do is different than speech therapy. So we work on function of the muscles, and muscles need to function for their function to work, right? Whatever that function is, whether it's sleeping, breathing, chewing, swallowing, speaking, our mouth muscles and our tongue have such important, delicate, and diligent jobs to do. And if we don't address the function, we don't always see improvements on what it is that you're trying to perform. So she was very happy with her results as well. And she decided not to have her tongue tie released. So just because a tongue tie is discovered or suspected does not mean you need to have a surgery. There's a lot of different things that go into it. It's not cut and dry, it's not black and white. It all comes down to function. If you can improve your functions and meet your own goals, then we may not have to do a tongue tie release. Now, I don't do the release here. We would work with a functional frenuloplasty provider or an airway focus provider who is trained how to in that procedure. She achieved her functions. She improved her sounds. She improved her sleep. She improved her chewing and swallowing coordination. She was happy. She was able to activate the posterior part of her tongue the way I would expect her to be able to. And she completed her program and was very happy with the results. Next, let's talk about a 72-year-old lady who was tongue thrusting. Essentially, that's when the tongue pushes on the teeth when you swallow. The tongue can also be pushing on the teeth at rest while you're sleeping, even while you're talking. So her lower teeth were flaring forward. They were flaring out because, again, remember, she's 72 years old. So she has been swallowing, pushing her tongue forward against her front teeth, her bottom teeth for her whole life. Her biggest concern was gum disease and tooth loss because the teeth on the bottom had shifted so far forward over her life that she was losing bone around her teeth. And her main goal was to stop the tongue thrust so that she didn't lose any more bone and then eventually end up losing lower teeth. She also has a bit of a lisp. So she was a bit lispy when she talked, and that was something that bothered her. And she feels like that was starting to get more profound as she aged. In her case, her story is a little bit different because we started therapy and then we had to stop because there were other health conditions that needed to take priority. So we stopped and then we came back. Then we prepared her for her tongue tie release so that she could learn how to then integrate a proper swallow. She's someone I'm still working with. We haven't completed her case yet because now there was another pause that needed to happen, again, because of personal and medical reasons. Now, this is not the most ideal situation. We want you to be able to start therapy and get through therapy. But the reason I mention this one in particular is because life happens. We can't always follow the perfect therapy schedule. So I do everything I can to keep in contact with you during our times of break or during the time where you need to pause. And we continue to at least keep going with the fundamentals of therapy, even though we're not meeting as frequently as I would like you to, so that you can achieve your goals within a reasonable amount of time. All right, you guys. Last one I'm going to talk about for today. 76 years old. 76. She has been a chronic clencher and grinder her whole life. Jaw pain, muscle pain, facial pain, neck, shoulder tension. And then she figured out tongue tie. Okay. She has a very narrow skeletal structure. And what I mean by that is her upper jaw is narrow. It was high and vaulted and narrow. And at her age, she decided to move forward and have a removable expansion device put in. So this is a device that she can take in and out. And she's been wearing it for a couple years because as you have an expander that comes in and out, especially when you get older, it takes longer for that expansion to happen because the expansion needs to move the bone, it needs to move the teeth, and that takes some time. So she's been looking for jaw stability. While we were working on myofunctional therapy, she had some great relief in her jaw, in her face. But what she didn't have a lot of relief was pressure and tension in the floor of her mouth underneath her tongue and then down through her neck. Because her tongue restriction was pretty significant, we got her ready for her release. We were able to expose the tissue that the doctor was going to work on, get a lot of tone in her muscles and a lot of elevation and coordination, which is what you need. You need that tongue to be ready for the release. It's not ideal to just go somewhere and have that string snipped. If you've referenced back to some of the previous episodes where I talk about tongue tie and different kinds of tongue tie releases, you want to do it the right way. And just snipping the string isn't going to address the issue, all right? Especially if you're older. And so anyway, through myofunctional therapy, the jaw was able to stabilize a lot more. The facial pain went away. But her restriction was so tight that even just keeping her tongue up on the roof of the mouth, it was fatiguing. And frankly, it bothered her because it didn't feel great. After she had her tongue tie release and we continued with myofunctional therapy, she was able to get that tongue up. And one of the first things she said to me after the release was, "My tongue's not tired. I can keep it up there now. And it's so much easier. I don't even have to think about it. It's not stressful." And that was fantastic because these comments that people make every single time they either have their tongue tie released or they finish their myofunctional therapy program, the benefits are so profound. And this isn't me just trying to tell you about how great this is. My patients, this is my clients telling me every single day how profound and life-changing their improvements have been with myofunctional therapy or myofunctional therapy and a tongue tie combination together. I love it. I love every single second of it because every day I hear people tell me how much their life has changed. And I cannot even tell you the amount of joy I get by being just a small little part of the process of your health and being and improving symptoms that have been ailing you for your entire life. I love what I do. Every day I hear this, and it makes my heart and my soul so extremely happy. You have no idea. So, anyway, I digress there a little bit, but my 76-year-old lady, I did mention that was going to be the last one I talked about today. To summarize, we talk a lot about young adult or mid adult or even young kids and how important myofunctional therapy is in helping to guide young people to have good function and good skeletal growth of their upper and lower jaws. We don't talk enough about the older population, and that's a good chunk of who I see. 50s, 60s, 70s, and I even had an 80-year-old that I started working with as well. So there is no age limitation to myofunctional therapy. There is no age limitation to having a tongue tie release. And there is no age limitation to grow your jaw and grow your airway so that you can sleep even better, breathe better, especially as you get older. So don't ever think that just because you're not a kid or you're not a 30 or 40-year-old adult, that myofunctional therapy is not going to work for you. Sometimes the most profound benefits come from the older population who have literally done every single thing and have tried every single gadget and tool that you can think of and have not been able to reach their goals until now. As always, thanks for listening. Make sure that you check out our website, myofunctionalpathways.com. Let's get you scheduled for a free, am I too old for myofunctional therapy? Discovery call. And let's talk about your symptoms and how they can change your life.
And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.